So how soon after a treatment can you spot a vascular occlusion? So this depends on many different variables. First of all, you've got to be looking for one. So the number one tip I can give you is look for vascular occlusions after a procedure. It is much easier to sleep better at night if after every procedure you know that you've checked that blood flow is normal after you left that patient. Work on your capillary refill technique, because a short tap on the skin is insufficient. You need to squeeze the blood out of the skin. So 4 seconds roughly of squeezing the blood out of the skin with a firm compress, and then you need to release it and look carefully and get that timing right. Now, for most cases, it's really obvious that the skin is normal, and you make a note of that. So in case the patient rings back, you've at least got that bit of information that it was normal when you last saw them. The big vascular occlusions should be obvious on the moment of treatment. So once you've done the procedure, if you do capillary refill test and it's a large vascular occlusion, it should be immediately visible. There is a theory that a small amount of filler could be in the vessel, not cause a vascular occlusion, because there are enough collaterals supplying blood to the tissue from other parts of the skin, but then it may break off and block off a small section. Now, they could come later, but by definition, that whole concept would imply that they are smaller. So you're unlikely to block a very large area with one of the delayed vascular occlusions. I think they're much rarer and they're much smaller. So we really want to be getting it right with those immediate vascular occlusions of large occlusions where you've injected 0.1, 0.15 into one artery. That should be very obvious as a problem. They shouldn't leave your office until you've restored that blood flow, and you should get that diagnosed immediately after the procedure, not 2 or 3 hours later when they've come back with symptoms.